child fell sick on the 10th of this very month. In the night, she started vomiting. Monday morning at 10 o'clock, I rushed her to the hospital. When she fell into coma, she died. 6 years, 6 months. If you don't have money, there's no need going to the hospital because they will not attend to you. For the 3 days I've been in the hospital, every little thing they had to do is go and bring this, buy this, buy this, buy this, buy this. So many people lost their lives in hospitals in this country because of finances. Unfortunately, one just died. I'm left with 3. 2 boys and a girl. You see, at this moment, I've not yet paid their fees, and I don't think they will continue going to school. I earn 60,000 francs from what I do. I can't do anything. That is it.
Without free universal health coverage, people like Anengi have to make impossible decisions about which of their children are more in need of medical care. And when they have to take their children out of school because they can no longer afford the fees, their families are subjected to another generation of poverty. Another repercussion of not having free universal health coverage is that in many countries, patients like Charlotte are held hostage by hospitals until their families manage to pay their medical bills.
Mais maintenant, le moment venu, ils exigeaient le reste d'argent qu'il fallait qu'on paye, les 400 000, parce qu'on a donné 100 000. Il restait 300 000. Et sur les 300 000, elle n'avait plus. J'ai fait parfaitement 3 mois à l'hôpital Sébec. Et pendant ce temps, pendant ces 3 mois-là, j'avais un stage, que je faisais un stage de couture. J'avais abandonné ce stage-là parce qu'il fallait que je retourne travailler à femme de ménage à l'hôpital Sébec pour qu'on puisse atteindre l'argent qu'il fallait et payer mes dettes qu'il avait. J'ai fait 3 mois à l'hôpital Sébec. C'était comme les prisonniers pour qu'on puisse travailler et pour se payer l'hôpital.
Not only was Charlotte's imprisonment an abuse of her human rights at the hands of those whose job it was to care for her, it also led to the loss of her training as a seamstress. Over and over again, we see that it's women who pay the price of doing all the unpaid work of looking after family members who become sick, as well as finding the money to pay for their medical care. Since her mother became sick, Anne-Marie has had to juggle all of this with supporting her children.
Sans l'enfance, je dois mourir. C'est elle qui me fait tout. Même pour laver, ça me dépasse.
Je gagne 50 000. Sur les 50 000, je paye ici là 12 000. Donc 2 000 la lumière et 10 000 la chambre. Donc il y a les mois, je peux passer même 2 mois. C'est pour acheter un peu de médicaments et pour les enfants. Vraiment, ça me dépasse. Puisque les enfants vont à l'école là-bas, ils sont à 25 000.
In Hanoi, Vietnam, Ohm sells tea illegally on the streets to pay for the treatment that keeps her alive.
Hôm nay em đến đây để hôm nay là lịch chạy ca, hôm nay em đến đây để chạy thận nhân tạo. Và mỗi tuần em phải đến đây 3 lần vào những ngày là thứ 2, thứ 4 và thứ 6. Chứ người giàu thì đã giàu rồi, được tiếp cận với các thiết bị y tế tốt hơn, lại được đầy đủ các thuốc thì họ lại khỏe mạnh nhanh hơn. Còn người nghèo đã không có tiền rồi, lại không nằm viện để bảo hiểm, lại phải mất tiền như thế thì mãi mãi không bao giờ giàu được, chỉ có mà nghèo mà bệnh tật thế chỉ nghèo mãi.
The inequalities in Hanoi are stark, And like elsewhere in the world, the gap between rich and poor is becoming more extreme. In India, for example, which has some of the most luxurious hospitals in the world, it's estimated that 63 million people a year are plunged into poverty because of their healthcare expenditure. And while the country's economy is growing, it only spends just over 1% of its GDP on healthcare. Because he's classed as being below the poverty line, Mr. Naik from rural India should have received free treatments after he fell from a tree 3 years ago. But until free healthcare becomes a universal right, there will always be the possibility of confusion and abuse of existing schemes which aim to help the poorest families, many which are illiterate and could be misinformed about their entitlements when they come into contact with the medical profession.
ମୋ ପାଖରେ ଯଦି ପଇସା ଥାନ୍ତା ଭଲ ଚିକିତ୍ସା ପାଇଥାନ୍ତି ମୋର ଗୋଡ଼ ଭଲ ହେଇଥାନ୍ତା ଭଲ ଡାକ୍ତରଖାନା ଯାଇଥାନ୍ତି
आज मरीज गोटे कि नून खंडे कि किसी गोटे खाइबाक मिलबार नहीं ताक तो गोड़ पड़ी गला बसला लोग तो बसीचे गोटे माँ बहन काट करनी की अरन खोजी खाइबाटा केटी गल गलानु
2 years ago, the Naik family also lost one of their daughters from tuberculosis because they didn't have enough money for her treatment.
मोर झियो खराब हिला का तार बापा हिंती कर डुली चैनल तार बापा हिंती कर नहीं ढुलती था मोर झियो तिले केते काम करी थी ताने कोई.
Like so many women, it's Sonu who's left trying to hold the family together.
मोर झियो तिले बेले एतकी डरमी नहीं है थी मी पो पाई थी झियो नहीं पाई थी म केते आराम से रखी थिला माँ बापा के हे छोटा खराब ही गला के हम के एतकी दुर्दशा होती थी.
Like so many families in so many countries around the world, they're looking forward to the day when governments will deliver on their promise to provide universal health coverage.